In this lesson, we will talk applications of community demographics and population health data, and strategies for improving data collection and utilization. Public health planning data are used to develop strategic plans for addressing community health needs, such as reducing chronic disease rates or improving maternal health. For example, a community with a high proportion of elderly residents may prioritize programs for managing age-related conditions like arthritis or dementia. Policy development. Policymakers rely on demographic and health data to create evidence-based policies that promote health equity. For instance, data on housing and health outcomes can inform policies to improve living conditions in low-income neighborhoods. Community engagement. Understanding demographics helps public health professionals engage with communities in culturally appropriate ways. For example, knowing the linguistic diversity of a community can guide the development of multilingual health education materials. Health equity initiatives. Data are essential for identifying and addressing systemic inequities in healthcare access and outcomes. For example, tracking disparities in preventive care utilization can help target outreach efforts to underserved populations. In this section, we will talk about strategies for improving data collection and utilization. Strengthening health information systems requires investing in integrated digital platforms to improve data quality and accessibility. Disaggregating data by key demographic factors, such as race, ethnicity, gender, and income, helps uncover hidden disparities and promotes equity. Building trust within communities by involving them in data collection ensures ethical and transparent use. Leveraging health tools and technologies facilitates data collection in underserved areas. Additionally, training public health professionals in data analysis and interpretation enhances capacity for informed decision-making. Now let's make a recap of this lesson. Understanding community demographics and population health data. Setting. Urban Health Department. Routine addressing rising chronic diseases. The City Health Department of Greenfield, a diverse urban area, has noticed a sharp increase in chronic illnesses such as diabetes and hypertension, particularly among low-income and minority populations. To address this, they decide to analyze community demographics and population health data to develop effective interventions. Step 1. Gathering community demographics and health data. The Health Department collects demographic and health data, including age, gender, ethnicity, income, education, chronic disease prevalence, and access to healthcare services. Analysis reveals high diabetes rates in low-income neighborhoods with limited fresh food access, elderly populations with high hypertension in specific areas, and language barriers in immigrant communities reducing preventive care access. Step 2. Public health planning. The Health Department uses the data to create a strategic plan aimed at reducing chronic disease rates. This includes implementing mobile health clinics in low-income areas for screenings and education, partnering with local grocery stores to offer affordable fresh produce programs, and developing age-specific programs to help elderly populations manage hypertension and diabetes. Step 3. Policy development. The Health Department leverages the data to advocate for zoning policies that encourage grocery stores to open in food deserts, funding for community health workers to overcome language and cultural barriers, and the expansion of public transportation to improve access to clinics in underserved areas. Step 4. Community engagement. The Health Department involves the community by launching multilingual health education campaigns tailored to the diverse population of the city, hosting community forums to understand residents' health concerns, foster dialogue, and build trust, partnering with faith-based organizations and local leaders to effectively reach and support marginalized groups. Step 5. Monitoring and evaluation. By tracking health data over time, they assess the impact of interventions, increased preventive care visits in low-income areas, reduction in diabetes and hypertension rates among target populations, improved access to healthy foods, and higher health literacy levels in immigrant communities. By effectively using community demographics and population health data, the Greenfield Health Department creates targeted, equitable interventions that address chronic disease disparities and improve overall population health. This data-driven approach fosters trust, ensures culturally appropriate programs, and promotes long-term health equity.